One test that we can do to help identify if the diagnosis is sciatica creating the leg or back pain is called a straight leg test. Now, this is the way we tend to direct it in our telehealth sessions, so keep in mind that it's a little sloppier than typical ones because we're not actually in person. But for most people, it gets the job done. So what we usually have them do first is bring the knee up into here, grab the thigh, and start to extend the shin to the point where they start to feel tension, and then you bring the foot towards the head and see if changing the foot position changes what their symptoms are in this location. It can also duplicate SI joint or low back and stuff like that. Now, if that doesn't work, we can have them do another sequence, which is going to be an active straight leg raise, grab it just for support, and then it's going to be foot cocked back. The sequence sometimes changes the results, which is why in-person is always better. But if you're looking for help about how to diagnose this, just reach out to us. We have virtual or in-person services, and watch some of our other videos that we have on YouTube.